There are more than 5 million Americans living with Alzheimer's disease. If you know someone with the disease, or you're afraid you may develop it yourself, we've got some information tonight that can help. So please stay with us. Welcome, I'm Father Mitch Pacwa, and welcome to EWTN Live, our chance to bring you guests from all over the world. Before we get to tonight's guest, I want to mention that tonight is the feast of St. Justin Martyr. He was born in 103 AD in Neapolis, which is today the city of Nablus in Palestine. And he wanted to be a philosopher, so he traveled around searching for the truth. And because he had such an honest search for the truth, he looked in all sorts of places. One of the places where he found peace in the truth was in Christianity. He became a Christian and became a defender of the faith. As a matter of fact, if you go to EWTN's website, EWTN.com, you can go to our documents library, and we have some of his dialogues on the faith. And his defenses of the faith. And you can download those and read those to this day. He was martyred in 165 AD, ironically by an emperor who considered himself a philosopher. But St. Justin Martyr is more remembered as the true philosopher who found the true way of life. Now, our guests tonight are here to tackle a very sensitive issue that affects so many people. The victims of the disease themselves, as well as their families and their network of caregivers responsible for their round-the-clock care. They're here at EWTN this week taping a new series called Remembering Jesus, where they help us develop a Catholic approach to preventing and treating Alzheimer's disease. So please welcome neurologist Dr. Vincent Fortanasce and Father Roger Landry. Dr. Vincent?
Thank you.
It's great to have both of you here, and I hope you've been enjoying doing the series.
Oh, we've loved doing it.
Oh, good, good. Where do you practice neurology?
I practice in Arcadia and over at USC.
Arcadia where?
Arcadia, California.
Oh, California.
Pasadena.
Okay, near Pasadena. Okay. And Father, where are you from?
I'm a pastor of St. Anthony of Padua Parish in New Bedford, and I run the Diocese of
New
Fall
Bedford,
Rivers, Massachusetts. And I run our diocese's newspaper up there as well.
Oh, okay, good for you, good for you. Now, how did you two hook up to do this series?
Through a mutual friend who knew that Father Vince wanted...
He's a doctor, you're the father.
Dr. Vince, listen to me. You make me nervous. Dr. Mitch. But through a mutual friend, Lou Cortese, Dr. Vince, listen to me, needed an interlocutor, somebody to do the program with him. And Lou knew that prior to entering the seminary, I was a biologist and a biochemist at Harvard and worked at Mass General Hospital for 4.5 years doing medical research. So she thought that this might be something that would interest me as well. Sure. And it clearly did, not only as a priest, but also looking at the larger cultural issues of how the church and our society approaches those with Alzheimer's disease. I very much wanted to work with Dr. Vince.
Now, you've been doing this kind of research for some time about Alzheimer's.
Yeah, approximately 33 years.
That's
and you know, one of the things that made me write is also I do a lot of bioethics. I'm a member of I'm a director of the National Catholic Bioethics Center, and so I've been doing bioethics for a long period of time. And what I noticed was that the incidence of Alzheimer's disease in my own practice had gone from about 2 patients per month to 2 or 3 patients a week.
So there's a significant increase of this disease in the culture.
Right. And not only that, but my dad came down with it. And so I learned what it really means and the hardship that people go through when Alzheimer's, because when Alzheimer's hits the patient, it not only hits the person, it also hits their entire family. And one of the things that alarmed me from the bioethical standpoint was that I found out that the calling card for the euthanasia movement was in fact Alzheimer's disease. And the reason for it is that it is in epidemic proportions. People have no concept of how. You had just said that it's 5 million. Well, since you've read, it's 6 million. However, a very careful study has come out to show that there's about half the people that we have not diagnosed, and more likely it's 10 to 12 million people.
In the United States alone, which is 1 out of every 25 persons.
And together with that, there is a category that we now call mild cognitive impairment. The people with mild cognitive impairment they're not people who cannot live alone. Essentially, the definition of Alzheimer's disease is an individual who could no longer live independently because of memory loss and behavioral changes. And so we realize that there's this category called mild cognitive impairment, in which we feel there's another 7 to 10 million people, and which convert to Alzheimer's disease, about 20% of them every year. We feel that if we can grab that group, and also realizing that there is a huge mass of people coming in, like for instance the baby boomers, we estimate that 40% of the baby boomers, of which there are 78 million in the United States, will get this disease, and that it's twice as prevalent in women as it is in men. So the economic cost of this, the trials and tribulations to family, and the pain that this disease causes, if we don't reduce the rate, and this is the reason why I wrote this book, The Anti-Alzheimer's Prescription, was that it would give people a menu, a plan, a prescription in order to avoid the disease. Because many people believe that we're going to come down with some magic bullet. But the truth is that there is no magic bullet. We've just spent $32.2 billion on 7 studies, and the end result, when you put them all together, is those patients who were not treated, those people who were in the placebo group, did better than the treatment group. So the American Academy of Neurology has come out and said, we do not have anything that's going to change this disease in the immediate future, and that means in the next 10 years. The only thing that works is prevention.
Yes. That's a very serious kind of thing to assert, because, like you say, people hope for a cure, like with cancer or something, but it's not like cancer. It's not going to have that kind of cure, and it's a progressive disease. It's something that starts off at various stages and develops into more serious stages. So it just gets more difficult as the time goes on.
And it's a devastating disease, because other diseases that occur, like a person who has cancer, you're able to relate to that individual. You're able to have compassion for that individual, because they can tell you their suffering that you're going through, and you can console them. When a person has Alzheimer's disease, often that is impossible. You actually lose the person. I've had people, like, for instance, Nancy Reagan has said, it's the never-ending goodbye. I've had patients who will come into the office, and I had this one little man and his wife, and they always used to hold hands, and this one time they weren't holding hands, and the wife turns to me and says, he doesn't believe them and his wife anymore. And the tears just came down her eyes, and he looked at her very suspiciously, and I said, you've been here many times, John. And he said, she's not my wife. She's an imposter. And you can see that the pain that was in that individual, the person who she loved, the person who she depended upon, the person who was her best friend, did not even know her.
Right.
So we're trying to prevent some of that pain. Once you come down with Alzheimer's disease, there is no cure, there is no magic bullet. But as we've been talking about in the series, For those with genetic predispositions to Alzheimer's disease, if they work through the anti-Alzheimer's prescription that Dr. Vince has formulated and is trying to promote through this series, they'd be able to delay the onset of Alzheimer's disease for 5 to 15 years. For that 30%, for the other 70% who could end up with Alzheimer's disease, if they followed this prescription, these various behavioral changes, they won't get it at all. And so that's why this is very urgent for us to do, not only to prevent the suffering for individuals and their families, but also to help our society avoid what is the great 21st century epidemic.
You know, one of the things that you have with a scientific background, but also with a priestly background, is an awareness of some of the pastoral issues that go into dealing with Alzheimer's. What are some of those?
Well, at the level of those with Alzheimer's, I've had several tell me over the last 12 years as a priest that they were afraid to come to confession, for example, because they couldn't make an examination of conscience. They couldn't remember anything that they had done. At the level of caregivers, it's one of the most vexing situations when people come to me for pastoral advice. Where I work, where there's a heavy Portuguese-American concentration, there's such a sense of guilt among many of them to put their loved ones in nursing homes in order to receive that 24-hour care for their loved ones. But it comes to a stage where they're working full-time and then they're coming back and they've found the burner left on at the stove. They get a phone call from the police department saying that their loved one was found someplace totally different in the city, where their loved one has wandered away. That in order to give them the moral permission, in a sense, that out of love for their loved ones, it's the proper thing to bring them into the nursing home. It's not a lack of love, it's a fruit of love to be able to do that. Those are two of the areas, both with the patients themselves as well as with the caregivers, where it comes up routinely in priestly life.
As a matter of fact, my impression has been with the families I've dealt with is that they've held on to caring for the person longer than was good for the patient. That they so don't want to let go that the patient can put him or herself in dangerous situations, you know, and the people are afraid to let go, and they feel guilty, as you say, but they need to because it's dangerous for the patient not to care for them.
Yeah, and I've even had situations like that where the wife knew how severe as their husband was as far as being affected by Alzheimer's disease, and would allow him to drive, and then they wind up getting into a very serious accident, and both of them are then hospitalized. And so you're right, and one of the reasons for it is that even though the person may be what you call demented or out of one's mind, they still see the individual as whole, and they don't recognize the fact that this individual is no longer the person who they knew, and that they have to treat them as if they were a child and protect them as if they were a child. And I've had CEOs come in with their family, and their family's still frightened of their father, who was always, you know, the commander of the ship. And I have to try to teach them that no, he is no longer the individual, and it is up to you to protect them. And not only that, but one of the sections that we have is on caring for the caregiver. Because it's very clear that caregivers within 2 years, 20% or greater come down with 50% or greater, come down with very serious diseases because of the stress that they're under.
Right. And and there's also sometimes fear. In addition, if there are children, there's fear, am I susceptible to this? Because there's the like you mentioned, a genetic propensity toward predisposition. And, you know, by the way, I was going to ask you or either one of you, is that predisposition testable? Can you find out if you have that predisposition, or is it just unknown?
No, you can find out. There are genetic tests that can test for 5 different types of genes right now that cause Alzheimer's, that predispose you, should say predispose you. Even though you may have the gene, it does not necessarily mean that you're going to come down with the disease. Because now we know that there are epigenes that actually activate certain enzymes, which will cause you to express whatever illness you may have on that gene. But yes, there are, and there's always the controversy: should you or shouldn't you have the exam done? But I think the most important thing...
Well, where do you come down on that?
I think that people should know. Yeah. Because if they do, they could enter a prevention program, and they can try to mitigate at least what we call the extrinsic factors. And those extrinsic factors are what we call part of the DEAR program. So anyone would like to find more.
What do you mean by DEAR program?
Well, anybody that wants more, you go to dearprogram.com. But DEAR program, DEAR stands for diet, exercise, accentuating the brain's reserve, which is brain exercises, and then rest and recover is the R, and that has to deal with sleep and with stress.
Well, what does sleep have to do with it?
Sleep, by the way, I'm glad you put that because that was the one I was going to talk about. God, you must be reading my mind. But sleep is probably the most important. There is a sleep problem called obstructive sleep apnea. If you snore, so if you have a spouse that snores, right, or you have a loved one that snores, they're overweight, especially if the woman has a waist of 35 or greater, or a man with a waist of 40 or greater, and that means not across the hips, but the umbilicus. If you have a 38 waist, you have really a 41-inch waist. And you're over 50, you almost certainly have obstructive sleep apnea. And there is a 12-fold increase in Alzheimer's disease if you have it. Because what happens, you do not get enough oxygen to the brain. Not only that, but during sleep, we talk about the hormonal symphony throughout the book and throughout our series. And what it is that there are certain youthful hormones and transmitters, and there are certain hormones that are aging. And what occurs between 20 and 70, the youthful hormones go down 80 to 90%, and you would hope that the aging hormones would go down the same amount. They go up 70%. So the whole program is based on how do we get the stress or the aging hormones down, and we could increase the youthful hormones. And on that basis, so what happens, for instance, in sleep with obstructive sleep apnea in people who sleep less than 7 hours a day is that their cortisol levels go way high because usually at night your cortisol levels go to its lowest level.
Cortisol is a stress hormone.
Is a stress hormone, the aging hormone.
Okay.
Right. And so what is occurring, because you're struggling to breathe, and people, by the way, who have obstructive sleep apnea don't even know they have the disease. I have obstructive sleep apnea, and my wife was telling me, and here's the person who I diagnosed, is telling me I snore, and believe it or not, all of a sudden I realized that I was falling asleep when I was dictating my letters. And so that's how hard it is sometimes, and some hard-headed, because I should have known, but I was hard-headed, male as usual. But anyway, what happens is that your cortisol level, even at night, is really hard. So you're aging 2 to 3 times the amount that you normally would. So sleep is of utmost importance. So, and many people say, well, you only need 6 hours. That's not true at all. If you're using up 8 gallons of gas or 7 ounces of gas a day, and you're only replenishing 6 gallons, and that is the 6 hours of sleep, at time you're going to go downhill much quicker than you normally would.
Sure.
And so getting enough sleep, learning how to take care of stress, knowing the importance of prayer and meditation. Because we have shown that prayer and meditation increases 2 of the neurotransmitters that are essential. I call these 2 neurotransmitters serotonin and dopamine, and I name them graceamine. Because when you have them, number 1, you're calm. Number 2, you sleep. Number 3, you have good executive function. You get things done. And number 4, you're able to avoid temptation. And that is alcohol, overeating, carb binging. And so within the book, what I do is I give you this formula. Very, very simple. Like, for instance, things like this. Don't eat bread first. Don't eat carbs first. The reason for it is that if you eat them first, it stimulates a hormone called ghrelin. Ghrelin then stimulates another thing in the hypothalamus that gives you carb craving. It's more addictive, actually, than cocaine. And so by just not eating carbs first, right, and eating protein first, you turn on a different hormone that causes you to eat less.
Which is the opposite of what goes on in restaurants, because in a restaurant, they bring you the bread first and the butter.
Why do you think?
Because it wants you to eat more.
Right. Well, because there are several studies, they don't know about these studies, but there's several studies have shown that if you eat bread first, right, you'll eat 20% more of your meal, you'll definitely buy an alcoholic drink, and you have 5 times as likely to eat a dessert. So it pays for them to give you bread for nothing.
Sure.
Otherwise, if they were giving you free shirts and it would cause you to buy more shirts at a department store, they'd be giving you free shirts.
Sure. Yeah, so, and this is one of the things that, Dr. Vincent was bringing up is there's a spiritual component to this. And what do you want to add to that in terms of the spiritual element?
Well, that fourth part, the elevated levels of uncontrolled stress in America, a lot of the times that is because we've distanced ourselves straight from God, and when problems come to us from without that are beyond our capacities to be able to deal with, we don't know quite what to do, and it starts to get us eating more, it takes us away from exercise, it disturbs our entire balance in life, that when we put God first, when we learn how to pray, and as we've talked about in the series, there have been lots of studies with religious women in communities. There have been studies with Buddhist monks that when prayer is done, because of the psychosomatic unity that God made us body and soul together, there are consequences in our brain. We start secreting, as Dr. Vince was saying, those youthful hormones. We start to create pathways to a certain part of the brain that helps us to look at the circumstances we face from a different perspective. He calls it the optimistic center of the brain, but we're no longer overwhelmed by those circumstances because we begin to realize that with God all things are possible.
That's one of the interesting things I've pointed out many times, is that nuns have the greatest longevity of any group in the country. It's a regular life. They don't smoke and have a lot of drink and things like that. And there's a lot of prayer in their lives and an order to their lives. And so that they get enough sleep, rest, work, all that balanced off. And they live longer than most other people.
And there was a study from Johns Hopkins that showed that they did some autopsies on some brains, all of which showed visible signs that they could have had Alzheimer's. But when they actually started to look at those two categories, about half of them did, the other half didn't, and the other half had at least 8 close social contacts. So when you're living in community life like women religious do, that stimulation that you have from the other sisters within your convent is not only beneficial spiritually, but it's also beneficial to your overall body as well as to your brain.
That's even something that shows up with a number of elderly people who do better when they have a pet.
Oh, exactly right. And that's one of the things we have in many of the Alzheimer's nursing homes. They will actually bring in pets and have them there because it is that community. Actually just touching another individual increases your serotonin and dopamine levels. We were talking about prayer, and a prayer in the brain is not something ephemeral. It's not something magic. It is actually a structure, a bridge. There is actually a bridge in the brain that goes to an optimistic center in the frontal part of the brain. If you use it a lot, if you pray a lot, that area projects out to several other areas that increases that serotonin, that dopamine, also growth hormone, all the things that are necessary that keep you youthful. You don't have to go and get injections. What you have to do, what you can do, and it's much cheaper, I tell people, is that pray and make sure it's a positive prayer. We were talking about there's 2 different types of prayer. There's a prayer, dear God, thank you for all that you've given me. Dear God, please let him die. I hate him. And there's the thinking that the vengeful prayer.
The second one is not the one that you're commending.
Right. And that, in fact, when you are pessimistic, when you are pessimistic, you're actually turning on a part of it. I talk about that's the angel in the brain, that left frontal, the optimistic side. And there really is a devil in the side because there is a pessimistic center. And if you're always going to that pessimistic center, guess what? You see everything pessimistically. And in that also turns on your alarm hormones, and that is your aging hormones. And so it is true. Those people who are pessimistic, those people who are angry, those people, they become depressed because all the youthful hormones are decreased and the stressful hormones increase. And that's what this book is all about, telling you and trying to teach people very simple matters, as simple as what type of exercise to do, what type of brain exercises to increase one's mental capacity. So there's many things, but...
doing things like taking up a hobby like painting is a very healthy thing to do. A lot of retired people will pick up something that they're physically more capable of, than they might not be as capable to do certain things, but they can do a hobby like painting or knitting and crocheting and variety of other things. That's not just something for old people to do to keep busy. It actually helps the process of aging.
Right, and the reason for it is that what people don't understand is that many people believe that the brain is a fixed bank account. And that is, you're given so many cells, and every time you bump your head, every time you take a glass of wine, every time you get a year older, you lost so many thousands until you're bankrupt. But it isn't. The brain really is an interest-bearing account. And if you use it, it will get larger, and you will get dividends. Because we used to think that the memory was stored in what I call the cell, that like this would be the cell of the body. But what we found out...
The cell of the brain, the neuron.
The cell of the brain, the neuron, yes. And what occurs is that out of each cell comes these branches called dendrites. And the memory is really stored like in the nail bed of each one, right at the end. These dendrites, even though it's very difficult to build new cells, but you can through exercise, by the way, but exercises for the brain increase the sprouting, and you can increase your capacity by increasing the number of dendrites. So it's very much like a miracle grow, right? These brain exercises are truly like giving nutrients to the brain. In fact, they stimulate what we call brain-derived trophic factors, and they stimulate genes that increase the arborization. So it's like fertilizing your brain.
What do you mean arborization?
Arborization means branches. Okay. So it's like the vine and the branches. And so we can maintain, no matter what age we are, our capacity. And unfortunately, at about 70 years of age, we start contracting our social contacts. And one of the beautiful things about religion, especially the Catholic religion, is that it's a religion of community. And the ability to maintain, by 80 years old, you have lost 90% of your contact, either through death or because you've hurt something and you're stuck at home. It is so important for us as Catholics and as a Catholic community. And what the church can do is actually have people go out to these people, bring them to church, bring them into community. And this will prevent them actually from getting Alzheimer's disease. It is that was the difference in what you were talking about when we took at with the pathology of two different brains. One group didn't have Alzheimer's and the other one did. And so we can do, each one of us can make a difference.
One of the things that this brings out is that it really comes across, God has made us to live our faith, that we're made for the faith. And that the more that we exercise the life of the faith, not just holding on to certain beliefs, but living out those beliefs, the healthier we are, because we were made to be believers who live in community and who have this kind of fullness of life that Christ promised us. We have to take a break. We'll be back in just a couple of minutes. We want to get some of your questions as well as questions from our studio audience, so please stay with us. Thank you, and welcome back. We have a really nice group of folks here from different parts of the country, And we'd love to have you come and join us in our studio audience if you get a chance. If you can come to EWTN and make a pilgrimage down here, please contact our pilgrimage department at 205-271-2966. That's 205-271-2966. Or you can go to our website, www.ewtn.com. They'll help you find places where you can stay. They'll help you schedule getting to the masses, to the television programs, get your maps up to Hansfeld so you can go see the sisters and join them for Mass and the beautiful singing that they do, as well as enjoy a tour of the network. So please contact them and come and see us. We love having you here. Are you ready for some questions? Let's start off with a call. We have Mary on the line. Hello, Mary.
Hello?
Hi, where are you from?
Florida.
Great. And what's your question?
We have a friend that is in the same parish as we are. She's 45 years older than we are. And she obviously has Alzheimer's, but she's trying to hide it from her family and our priest. And we try to do as much as we can for her, but we're really worried about her, and we don't know what to do. If you have any suggestions. I know she still prays the rosary and she does all that, but she repeats everything. She goes over everything over and over and over again. And then she takes off. She'll drive, and she's not supposed to be. She's 87 years old.
Okay. So what do you suggest in that kind of situation?
This is a very frequent problem. And because, as we had mentioned, people who have Alzheimer's disease often don't recognize it. So it's not a question of them being obstinate, whatever have you, or that they're in denial. They're completely unaware. And so it takes the reality of the people that are around them in order to say, hey, you have a problem, contact family members, and tell them that the person has to be seen by a physician. In many states, there are rules that if a person has a dementia, all right, especially Alzheimer's disease, their license is taken away because they are a danger to themselves and to others.
Exactly.
We've recently had something in California where an individual who had Alzheimer's disease drove into a number of children who were crossing the street and injured 7 of them. And so it really behooves us to act before it is too late. And so that if you really believe that that person is, for instance, repeating the same story to you, after you told them what to do, they ask you as if you'd never said anything before, or showing really severe short-term memory or paranoia that people are taking things, all right, or getting lost when they drive, all signs of early Alzheimer's disease. But the problem is they truly are not aware of it. It's not denial. It is complete inability to see themselves.
Right.
And that is and their insight and judgment is poor. And you, as a Christian person, must take the bull by the horns and do something about it before they hurt someone else or themselves.
And this is a friend. She might be able to take this lady to a doctor herself, or she might have to get the family involved, because there are certainly a variety of legal questions as to who has responsibility. But this is one of the things that you have to try to figure out, because who has right of attorney and things like that.
Well, you can call. Every state has social service, and you can actually call the office and tell them that you are worried about the competence of an individual.
Oh, okay.
And so once you do that, they are then required to send someone out to find out if that person is capable or not.
But that would be a last resort, not first resort.
Right. That would be a very, very last resort.
Those who love them to try to get them involved right off the bat. Some of the
then,
times they're living far away, they're in other states. And
especially in Florida, because so many people retire down there away from their families. So that can be a real situation.
Yeah. It would be important to know if she was living alone or not.
Right.
And what relatives that are nearby that might be able to intercede. But it's amazing. It is amazing to me how reluctant people are to intercede because they're afraid of overstepping their boundaries.
Right. No, that's exactly right. We have a question from our studio audience. Sir, where are you from?
Dallas, Texas.
Good to have you here, and welcome. And what's your question?
Doctor mentioned two neurotransmitters, serotonin and dopamine. And the question is, millions of people on serotonin reuptake inhibitors maintaining higher serotonin levels. And does that show any evidence of helping in drugs that might increase dopamine levels? Would that also help delay the onset?
There have not been any studies really to show it definitely, but it should theoretically. One of the difficulties is that most of the serotonin uptake inhibitors are antidepressants. And so since they're antidepressants, what they will do is usually these people are depressed. And we now know that the incidence of Alzheimer's disease is double to 3 times in people who are depressed. And so it is important to get these serotonin inhibitors in order to reuptake inhibitors in order to increase the levels of serotonin. Mm-hmm. And theoretically, it should help, and we should be using them, and we should not be avoiding it. But of course, it has to be used on people who are truly depressed, and that is people who are maybe having early morning awakening with feelings of dread, feelings of depression, inability to get things done, and who then maybe either eating too much or too little.
Mm-hmm. Okay, all right. We have another caller. Todd, you there?
Yes.
Hi, Todd. Where are you from?
Wisconsin.
Great. And what is your question?
Okay, I'm a primary caregiver for my 92-year-old mother. Her doctor likes to call it dementia, not Alzheimer's. And she's 92, and I've removed all the dangers that I feel could put her or anyone else in harm. And I don't want to let go. Is that good enough? Or am I being selfish to not to consider putting her in a facility? And is there a difference between dementia and Alzheimer's, or is it just semantics? Thank you.
Oh, thank you very much, Todd. And we'll pray for you taking care of your mother along with the other people who are caretakers.
Well, I think that's an excellent question. And Todd, I want to say that I have a 98-year-old mother, and my sister Elaine is the primary caretaker, and God will bless both of you, my sister and you, because of the fine work that you've done for the person that you love and who's done so much for you throughout the ages. But and to answer the question is this, is that when the question is really, when is it best? When are you actually showing more love for your mother, to put her into a facility that can take care of her, than keeping her home and, like you're saying, being selfish? Well, you're not selfish at all, right? But it also is very important to know when you are actually putting her in danger. So if, with the criteria that we use, is that if there is a danger to the individual, or that person can put other people into danger, that is a person needs 24-hour care. And if you cannot supply that at home, you really do need to put them into a facility where they can give them that care. Usually the indications are, number one, that they begin to wander, and you can't find out where they are. Number two, that they start having bowel and bladder problems, and therefore, you can't take care of that, and it could subject them to infections. Number three, and one of the more common ones, is they become aggressive or also belligerent. And it is in those criteria, or they're in great danger of falling, because many of the people after 80 years of age, actually after 70 years of age, have joint problems and are at a very high risk of falling. And if they fall and break a hip, there is a 50% chance within 2 years that they're going to die from some complication of that. So it's important to think of what is going to be the safest thing for them. Also, it's very important for the caregiver to realize that if something happens to them, if they become ill, that is going to force their loved one into a nursing home. Right. And they have to take care of themselves. Right now, the toll that is being paid by caregivers is immense. And we as a Christian community have to reach out to people like Todd, like my sister, and help them.
Mm-hmm. Now, he also asked a question about whether there are different kinds of dementia. Is it all Alzheimer's or the different kinds of dementia?
No. Well, essentially what it is, dementia is an overall category. It's like the common cold, but there is pneumonia, there's viral infections, there are many other types of pneumonia. But it's an overall, so dementia means dementis, out of one's mind. Alzheimer's is a type, and it's the most common type, about 70%. The difference between the two is that people with Alzheimer's disease usually have good clarity of mind. So they could be sitting there like you, and unless you gave them a mental status, like one time I gave my mother, I asked her 3 words. I said, Mom, I'm going to ask you for them in about 3 minutes. Then I threw her off a little, and I went back and I said, what were the 3 words? And she couldn't remember any of the 3. And then that's when I started giving her the DEAR program. And I came back another time and I asked her 3 words. She got 2 out of the 3 right. And she was 7 years older. She was 97, not 90 anymore. So the DEAR program actually works.
And again, just repeat what the DEAR stands for.
DEAR stands for diet, exercise, accentuating the brain's verb, that is doing brain exercises, and rest and recovery, which deals with sleep and with stress.
Okay, good. Let's go to another question from our studio audience. Ma'am, where are you from?
Long Island, New York.
Great, good to have you. And what is your question?
My question is for Dr. Vince. I'd like to respond. You had said that socialization is something that can prevent Alzheimer's. What would you think about having socialization for someone who's just been diagnosed with Alzheimer's?
Well, I think it is good. I mean, unfortunately, there's been no proof to show that socialization will slow down the disease. But what I always tell people is that do things that are logical. Just because the medical profession has has not proven something, like for instance, there's many things that they've told us to do, like eat no fats and have a lot of carbohydrates, and it proved to be that's one of the main causes for dementia and also for heart disease, right. The very same thing that they were going to. So you have to use common sense, and it's very clear that people who have high socialization, right, it causes the brain to be challenged, and so therefore it should slow down the effect of it. Unfortunately, there's no proof that once you have the disease that prevention slows it down. But I do believe that in the future, if a full set of lifestyle changes occur, and that is that they're exercising, they're eating the correct diets of high antioxidants, and that they're challenging their brain and they're getting the proper amount of sleep, that for all intents and purposes, it should slow it down. Right now, we don't have any other choices. The medications that we have, such as Aricept, Exelon, Namenda, they do not decrease or slow down the disease by even a single day. They may make the person a little bit brighter and be able to attend to things a little bit better for maybe 6 months. But unfortunately, a lot of people are taking these drugs for years and years and years, and you really have to go back to your physician and say, is this really being effective? Especially because some people are very limited in their funds. They only get $900 or $1,000 a year, a month, and here they are spending $300 and $400 a month on these medications. So it's very important that you have a gerontologist, that you have a neurologist that you're taking your mother to, and who's really has kept up on the latest science.
Right. We have another caller. Jean, are you there?
Yes.
Hi, where are you from?
Louisiana.
Great. And what is your question?
Well, I'm a CNA, and it's for Dr. Fortanasce.
Yes.
Yes?
What's the best way to take care of Alzheimer's patients? I work one-on-one with them.
So what's the best way to take care of Alzheimer's patients? This lady works with them one-on-one.
Mm-hmm. We have one of the segments that we did, we give hints, all right? First of all, it's very important to know what stage they're at, all right? Because the treatment becomes very different according to if it's their first stage when it's mainly memory problems, or the second stage when it's mainly behavioral problems, and that is they become violent, they become angry, they become resistant, and then the last stage is when they can barely walk, they can't clothe themselves, right. They can't have bowel. So what I always say, the hints are this, all right, is that is speak in short sentences, all right, point to what you're saying. Always use their first name. Always look them in the eyes. All right. Always be at their level and don't look down at them. All right. Always give positive comments. And when you want them to do something, don't ask, do you want to do such and such? Right? You say, we are going to do, and you lead them. Because if you give them a choice, they may become resistant, only because they don't understand what you mean even. And so there are some practical hints. And then, of course, there are many other ones, but I hope that is helpful to you.
Yeah, those are some things. And, I remember working with one lady who had Alzheimer's. And in the early stages, one of the ways that we used to test was to see what she could laugh at. Because the ability to see the illogic of a joke or of a situation indicates that they have that much logic to know the illogic.
That's an excellent test. In fact, abstract thinking, like, people in glass, you could ask them, people in glass houses shouldn't throw stones. What does that mean to you? And if they say, well, if you throw a rock, it's going to break my house, that you realize that they really haven't grasped, the fact that what it really means is that if you have a fault, don't be blaming other people.
Right.
And so the ability to abstract is one of the first things that go, and that's because there is this arborization. That is all these connection cells. You have your cell, your neuron, and then you have its branches. And as Alzheimer's comes down, it starts breaking down those branches. And so one of the things the analogies I use is that you see a dog and you have a seeing cell, and there's the dendrite coming out, the branch. And then you have a naming cell, and it connects with it. And so you see a dog and you say, dog. However, if those break, you could see the dog. You may know what it was, but you're not going to be able to name it. In fact, one of the early signs of Alzheimer's disease is the inability to name people that you even know.
Right. Let's go to another question from our studio audience. Ma'am, where are you from?
Birmingham.
Birmingham. Great to have you here.
Thank you. I wanted to ask Dr. Vince, there has been some talk lately about expressive arts, creative arts being used as a therapy when someone is in Alzheimer's. Is there any evidence that that might be helpful as a prevention kind of therapy? And what other kind of exercises were you talking about? You said there were mental exercises that might be preventive.
Yeah, that would be one of them. When we talk about accentuating the brain's reserve, or we call it neurobics, rather than aerobics or anaerobics, which is physical exercise. Those type of things should try to increase the amount of dendrites coming out. Unfortunately, as I had mentioned, once people reach that state in which they have such a tremendous loss, there's a question of how much it truly does help. But it's very important, if you do not have dementia and you're retired, that you truly learn other manners of dealing with people. And that is that you get them out, you teach them a new instrument, you try to learn a new language, you do art, you do music, you accentuate what I call email, and that is the 5 cognitive function, and then all your sensations, like aromatherapy. It's very important to pick it up, try to smell what you're doing, and then actually try to think of what does it remind you of. I'll smell sauce and I'll think of my mom, and I'm in the kitchen with her, and she's grabbing a meatball, stabbing it, and handing it over to me, And so there are many things, emotions, in many parts of the brain that you can actually increase the amount of branches in order to maintain your capacity, despite the fact as we get older, we do lose more and more cells. And exercise, which we haven't even hit, which is probably one of the most important things to decrease your stress hormones, and it is one of the only ways after 50 years of age to increase the number, it's called neogenesis, the number of new brain cells.
As a matter of fact, one of the things I like to do is I go to the gym to work out, and I bring my Arabic textbook with me so that instead of counting reps, I'll conjugate Arabic verbs.
We all do that, Father Mitch.
See?
That's it.
That's a good practice.
Well, you can actually start, what I recommend too, is that you could actually pray while you're exercising.
Sure.
And so you're doing double duty. You're building up those bridges to the optimistic center. You're reducing your cortisol levels. And at the same time, if you exhaust your muscles, there's a whole program called isometric exercises, which are the most effective, because when you exhaust that muscle, it sends off an enzyme that stimulates these brain-derived trophic factors that do two things. One, stimulates a we're going to get into this stuff, a cytoskeletal gene, which makes your muscles bigger and it's one of the only way women can make their bones denser. And at the same time, it goes over to two other genes which cause new brain cells to be formed and increases, like a miracle grow, the dendrites, and that is the ones that have the memory cells at the end, and increases your capacity. Exercise is of utmost importance. And the saddest thing about it is the Nielsen study shows that we watch TV as an adult 5.5 hours a day. And people say they don't have time to exercise. One of the beauties of the exercise program and the DEAR program is that you can do it watching TV. We could actually do it right here. In fact, I was just doing it, and I am doing it right now.
Matter of fact, one of the things, I still have two great aunts. I love them. They're so great. And I told them, as a matter of fact, now I'm a great uncle. That makes them great, great, great aunts. One of them smacked me. What are you telling me that for? But the thing that one of them does is when she watches TV, because she is rather elderly, she'll be on a little bicycle that's at her, at her chair. Wonderful. And she'll exercise by doing that bicycle while she watches TV, because she can't ride a bike like she used to, but she can, do that at her chair. And just finding ways to do some more exercise is a good thing.
Oh, just excellent. And the more that we can watch our diet and fill it with the antioxidants, exercise, and make sure that we do 10 to 20 minutes a day, that can be done. There's no reason why you can't. You can do it in a chair, the sufficient exercises. There's no reason why you can't be doing brain exercises. And as far as sleep,
which is not on most TV stations. This one, right. Yes. This one, yes. This is a good brain exercise.
Yeah, this is an excellent brain exercise. In fact, we even talk about when that Alzheimer's begins in childhood, and what are the 3 T's that are actually destroying the brains of our youth, all right? And that is TV. Youth, by the way, use the 3 T's 8.2 hours a day. TV, telephones, and our technology, meaning the net, and violent video games. They're not only addicting, especially the violent video games, not only are causing addictions, the net is causing an epidemic of porn-addicted children.
Yes, yes.
And the destruction that it's doing to our brain is because when you do a violent video game, it excites a part of the brain that causes addiction. So addiction to thrill-seeking. And not only that, but the thrill-seeking also causes tremendous anxiety. And so these people are more likely to become gamblers at night, gamblers someday. And then because of the tremendous anxiety that these games are causing, they have to self-medicate. And what do? They take alcohol or they take illicit drugs. It is an epidemic. And unless parents realize that the gifts that they think they're giving their children are actually destroying them.
Now, I've got just a couple of minutes. Becky, are you on the phone?
Yes, I am. Thank you.
Oh, great. And where are you from?
I'm from Virginia.
And what is your question?
My question is the reluctance of Christians today, and probably not just Christians, but most people, is to trust the doctors and to trust the drugs rather than trust God and trust His Word. And for example, I'll use the dopamine, and doctor would say, well, I'll give you dopamine, and I would say, well, that will increase something good in my brain, right? Well, yes, but maybe not, and maybe, but if I read the Psalms or read God's Word every day, that would give me natural dopamine, or this natural drug that's already in my body.
I've got just a very short time left, so that's your statement?
Yeah.
Okay, thank you, Becky. Now, is she right?
I agree.
Okay.
I agree, but what you really have to do is when you see a doctor, you have to have a doctor who understands the disease. And it is not a pill. Unfortunately, that's what we're taught. That's the only thing doctors believe that they have to offer.
Right.
We have a lot more to offer you,
Right.
and that is a prevention program. However, it takes time, and often doctors don't have that time to explain it to you.
All right. Well, speaking of not having time to explain things, we have run out of time. I want to thank both of you for being here with us. It's a very important topic, and it's very, very useful. And Father, would you join me in giving a blessing to our audience?
Sure.
May Almighty God bless you and keep you and cause His face to shine upon you and lead you in all of His ways by His peace. In the name of the Father, the Son, and the Holy Spirit. Amen. And, you know, this has been a great program. I hope you've enjoyed it. But I want you to realize that if you've enjoyed it, it's because you've made it possible. You make this whole network possible by your gifts and donations. And so we ask you to help us out so we can keep bringing guests who are making series like the ones that they're doing and informing our people and informing our faith with these issues. Keep us in between your gas bill, your electric bill, and your cable bill, and we'll pay all of our bills. God bless you and thank you.